This tumor sidedness thing is interesting because in some ways I feel stupid that we hadn't seen it before. It's so easy, right versus left. We don't need a molecular analysis or whole exome sequencing or whatever. We just look at cecal cancers versus sigmoid cancers and you see a difference. And actually when you go back to clinical trials, we have known this for almost 20 years, but we didn't really pay attention, but it probably also didn't have any clinical consequences. So I think it's very clear that right-sided tumors have poorer prognosis than left-sided tumors. And left-sided tumors actually include rectal cancer. So it's rectal cancer and colon, left-sided colon cancers are more similar than left-sided and right-sided colon cancer. So we really need to change the way we talk about colorectal cancer, left and right versus colon and rectal. Now, the interesting thing that came out of ASCO was not only prognosis, but potentially also a predictive factor. How do, in particular with anti-EGF receptor antibodies, cetuximab, panitumumab, they do not seem to work well in right-sided cancers, even if you look for RAS or KRAS wild-type tumors, but they seem to work better in left-sided cancer. So whereas the angiogenesis inhibitors, bevacizumab for instance, were kind of agnostic, they worked in both sides, EGF receptor antibodies did not seem to work in right-sided but in left-sided cancer. So how this will influence our clinical decision guidelines potentially and the design of future clinical trials will remain to be seen, but it's very clear that we now need to at least use sidedness, and that's really a word, sidedness as a stratification factor for clinical trials.